Health workers have set up clinics in Eastern Democratic Republic of Congo to treat hundreds of Ebola patients. Doctors in Beni are working to identify the symptoms as soon as they can.
We're examining the patients earlier than we've seen them previously, and so these patients may not have developed disease yet, so it's something that they need to be followed long-term to ensure that they don't develop complications or eye inflammation. And I think we're all still learning from the Ebola survivors and the eye disease and ocular complications.
Blurry or reduced vision, or in some cases even blindness. This has become a common problem for nearly 20% of Ebola survivors. In the eastern town of Butembo, some families have been separated by the disease, and survivors are doing what they can to help.
No one else can take care of kids whose parents are affected by the outbreak. Her mother isn't able to take care of her daughter because she's suffering and can't risk affecting her kids. She's safe in my hands, as I was cured from Ebola and I can't be affected again.
Some have been sharing their experience of Ebola to help others stay healthy.
I've decided to raise awareness so that I can save the lives of my brothers and sisters who are doubting that Ebola exists. Through our testimonies, we're telling people Ebola is real.
But the disease is still not under control. In fact, it's spreading. Since last October, over 1,000 cases have been reported. 18 new cases were identified just this week. And fighting between armed groups in the east have hampered efforts to contain Ebola. The Red Cross says it's also affecting people's trust in the medics who can help them.
The level of mistrust that we're seeing in the community is an operational challenge, and it can stem from long-standing conflict in the region, and this is the first time this region is seeing an outbreak of Ebola in a while. And it's for this reason that we're putting community-based approaches to safe and dignified burials, as well as community feedback systems at the core of our response. It's only by understanding the beliefs of the community that we can build trust and stop this outbreak.
This is the second worst outbreak since the virus was discovered in 1976. It swept through West Africa in 2014, spreading to the US, UK and Spain, killing at least 11,000 people, which is why finding a solution to reverse the latest epidemic is becoming even more critical. Raheela, Mahomed, Al Jazeera.